Did you know that over 54 million adults in the US alone are battling arthritis? Whether you're young or old, active or sedentary, arthritis can affect anyone. But what exactly is arthritis, and why does it matter? Stick around as we break down the top 10 types of arthritis you need to know about and how they could impact your life or the lives of your loved ones. Welcome to our channel. Arthritis isn't just one single disease, but a term that refers to over 100 different types of joint pain or joint disease. This condition can lead to debilitating pain, reduced mobility, and a significant impact on daily life. But don't worry, we're here to help you understand more about this complex condition. In today's video, we'll explore the top 10 types of arthritis, shedding light on what makes each one unique and how they can be managed. Let's dive in. Imagine waking up and feeling a persistent ache in your hands or knees. At first, it's just a minor discomfort, something you think will pass. But over time, the pain lingers and worsens, making it difficult to perform simple tasks. This is the reality for many people living with osteoarthritis, the most common form of arthritis. Osteoarthritis happens when the protective cartilage that cushions the ends of bones wears down over time. This cartilage acts like a shock absorber, allowing smooth, frictionless movement of the joints. But as it deteriorates, the bones begin to rub against each other, leading to pain and inflammation. This condition can affect any joint, but is most commonly found in the hands, knees, hips, and spine. Let's talk about the symptoms. Osteoarthritis usually develops slowly and gets worse over time. You might notice pain, your joints hurt during or after movement. Stiffness, especially noticeable when you wake up or after being inactive. Tenderness, your joints feel tender when applying light pressure. Loss of flexibility, you can't move your joint through its full range of motion. Grating sensation, you might feel or hear a grating sensation when using the joint. Bone spurs, hard lumps of extra bone can form around the affected joint. Swelling, caused by soft tissue inflammation around the joint. So, why does this happen? While osteoarthritis is often called a wear and tear disease, it's more complex. Besides cartilage breakdown, it affects the entire joint, causing changes in the bone and deterioration of the connective tissues that hold the joint together and attach muscle to bone. Inflammation of the joint lining is another factor that contributes to the discomfort. Certain factors increase your risk of developing osteoarthritis. Age, the risk increases as you get older. Gender, women are more likely to develop osteoarthritis, though the reasons are unclear. Obesity, extra body weight puts additional stress on weight-bearing joints like your hips and knees. Fat tissue also produces proteins that can cause harmful inflammation. Joint injuries. Injuries from sports or accidents, even those that happened years ago, can increase the risk. Repetitive stress. Jobs or sports that place repetitive stress on joints can lead to osteoarthritis. Genetics. Some people inherit a tendency to develop the condition. Bone deformities. Malformed joints or defective cartilage from birth can increase the risk. Metabolic diseases. Conditions like diabetes and hemochromatosis, excess iron, can contribute to osteoarthritis. While there's no cure for osteoarthritis, its symptoms can often be managed. Staying active, maintaining a healthy weight, and seeking treatments can slow the progression and improve joint function and pain. Rheumatoid arthritis, or RA, is a chronic inflammatory disorder that can wreak havoc on more than just your joints. Imagine your immune system, which is supposed to protect you, mistakenly attacking your own body's tissues. This is the essence of RA, and it doesn't stop at the joints. It can affect your skin, eyes, lungs, heart, and even blood vessels. Unlike osteoarthritis, which is caused by wear and tear, RA targets the lining of your joints, leading to painful swelling. Over time, this can cause bone erosion and joint deformity. But what makes RA particularly insidious is the inflammation that can spread beyond the joints, causing damage to various body systems. So, what should you look out for? Common signs and symptoms include tender, warm, swollen joints, joint stiffness, particularly in the morning or after periods of inactivity, fatigue, fever, and a loss of appetite. RA often starts in the smaller joints, like those in your fingers and toes, before progressing to larger joints such as the wrists, knees, and shoulders. Around 40% of people with RA experience symptoms that don't involve the joints. This can include issues with the skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, and blood vessels. The severity of these symptoms can vary and may even come and go, with periods of flares and remissions. Risk factors for RA include being female, middle age, family history of RA, smoking, excess weight. RA isn't just about joint pain and stiffness. It can lead to severe complications such as osteoporosis, which weakens bones, rheumatoid nodules, firm tissue bumps around pressure points, dry eyes and mouth due to Sjogren's syndrome, increased infections due to a compromised immune system, abnormal body composition with a higher proportion of fat to lean mass, carpal tunnel syndrome from wrist inflammation, heart problems, including hardened and blocked arteries, lung disease, causing inflammation and scarring, lymphoma, a type of blood cancer. While there's no cure for RA, early diagnosis and modern medications have significantly improved treatment options. Lifestyle changes, such as maintaining a healthy weight and not smoking, can also help manage the disease and reduce the risk of complications. Living with rheumatoid arthritis can be challenging, but understanding the condition and taking proactive steps can make a big difference. Psoriatic arthritis is a form of arthritis that can affect those with psoriasis, a skin condition characterized by red patches topped with silvery scales. Interestingly, many people develop psoriasis long before they ever experience joint issues. However, for some, joint problems might appear simultaneously with skin symptoms or even before any skin issues arise. The main signs of psoriatic arthritis include joint pain, stiffness, and swelling. These symptoms can target any part of the body, from your fingertips to your spine. Psoriatic arthritis can affect joints on either or both sides of the body. The symptoms often mimic those of rheumatoid arthritis, such as painful, swollen, and warm joints. However, psoriatic arthritis has some distinctive features. For instance, it can cause a painful sausage-like swelling in the fingers and toes, known as dactylitis. Foot pain is also common, particularly where tendons and ligaments attach to bones, like the Achilles tendon or the sole of the foot. Lower back pain might occur due to spondylitis, which involves inflammation between the vertebrae and between the spine and pelvis. Psoriatic arthritis can also affect the nails, causing pitting, crumbling, or separation from the nail bed. Eye inflammation, known as uveitis, can cause pain, redness, and blurred vision, potentially leading to vision loss if untreated. So, what triggers psoriatic arthritis? It occurs when the immune system mistakenly attacks healthy cells and tissues, leading to joint inflammation and an overproduction of skin cells. Both genetic and environmental factors are believed to play roles in this response. Many people with psoriatic arthritis have a family history of psoriasis or psoriatic arthritis. Several factors can increase the risk of developing psoriatic arthritis. Psoriasis, the most significant risk factor. Family history, having a parent or sibling with the disease. Age, most common in adults between 30 and 55. In rare cases, psoriatic arthritis can lead to arthritis mutilans, a severe and disabling form that destroys small bones in the hands, leading to permanent deformity. Additionally, psoriatic arthritis can increase the risk of developing other health issues like hypertension, metabolic syndrome, diabetes, and cardiovascular disease. Ankylosing spondylitis, also known as axial spondyloarthritis, is a chronic inflammatory disease that can cause the vertebrae in your spine to fuse over time. This fusing leads to a loss of flexibility, potentially resulting in a hunched posture. If the condition affects your ribs, it can even make deep breathing difficult. Axial spondyloarthritis comes in two forms. If the condition shows up on an X-ray, it's called ankylosing spondylitis. When it's diagnosed based on symptoms, blood tests, and other imaging tests without X-ray evidence, it's known as non-radiographic axial spondyloarthritis. Typically, the symptoms start in early adulthood. The most common initial signs include persistent back pain and stiffness in the lower back and hips, particularly noticeable in the morning or after periods of inactivity. Other frequent symptoms are neck pain and fatigue. These symptoms might come and go, worsen, or improve over time. Ankylosing spondylitis often targets the joint between the base of the spine and the pelvis, the vertebrae in the lower back, tendon and ligament attachments to bones, especially in the spine and sometimes in the back of the heel, the cartilage between the breastbone and ribs, hip and shoulder joints. In severe cases, the body attempts to heal by forming new bone, which can fuse the vertebrae together, resulting in stiffness and inflexibility. This fusion can also affect the rib cage, restricting lung function. Other complications include eye inflammation. Uveitis, a common complication that causes rapid onset eye pain, light sensitivity, and blurred vision. Immediate medical attention is crucial if these symptoms occur. Compression fractures. Weakened vertebrae may crumple, worsening a stooped posture and potentially injuring the spinal cord and nerves. Heart problems. Inflammation can enlarge the aorta, distorting the aortic valve and impairing its function. This condition also increases the general risk of heart disease. While there is no cure for ankylosing spondylitis, treatments are available to help manage symptoms and potentially slow the progression of the disease. Gout is a common and complex form of arthritis that can affect anyone. It's characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, most often in the big toe. An attack of gout can occur suddenly, often waking you up in the middle of the night with the sensation that your big toe is on fire. The affected joint is hot, swollen, and so tender that even the weight of the bedsheet on it may seem intolerable. Gout symptoms may come and go. They include intense joint pain. Gout usually affects the big toe, but it can occur in any joint. Other commonly affected joints include the ankles, knees, elbows, wrists, and fingers. The pain is likely to be most severe within the first 4 to 12 hours after it begins. Lingering discomfort. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. Later attacks are likely to last longer and affect more joints. Inflammation and redness. The affected joint or joints become swollen, tender, warm, and red. Limited range of motion. As gout progresses, you may not be able to move your joints normally. Gout occurs when urate crystals accumulate in your joint, causing the inflammation and intense pain of a gout attack. Urate crystals can form when you have high levels of uric acid in your blood. Your body produces uric acid when it breaks down purines, substances that are found naturally in your body. Purines are also found in certain foods, including red meat and organ meats such as liver. Purine-rich seafood includes anchovies, sardines, mussels, scallops, trout, and tuna. Alcoholic beverages, especially beer, and drinks sweetened with fruit sugar, fructose, promote higher levels of uric acid. Factors that increase the uric acid level in your body include diet. Eating a diet rich in red meat and shellfish and drinking beverages sweetened with fruit sugar, fructose, increase levels of uric acid, which increase your risk of gout. Alcohol consumption, especially of beer, also increases the risk of gout. Weight. If you're overweight, your body produces more uric acid and your kidneys have a more difficult time eliminating uric acid. Medical conditions. Certain diseases and conditions increase your risk of gout. These include untreated high blood pressure and chronic conditions such as diabetes, obesity, metabolic syndrome, and heart and kidney diseases. Certain medications. Low-dose aspirin and some medications used to control hypertension, including thiazide diuretics, angiotensin-converting enzyme, ACE, inhibitors, and beta blockers, also can increase uric acid levels. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. Family history of gout. If other members of your family have had gout, you're more likely to develop the disease. Age and sex. Gout occurs more often in men, primarily because women tend to have lower uric acid levels. After menopause, however, women's uric acid levels approach those of men. Men are also more likely to develop gout earlier, usually between the ages of 30 and 50, whereas women generally develop signs and symptoms after menopause. People with gout can develop more severe conditions, such as recurrent gout. Some people may never experience gout signs and symptoms again. Others may experience gout several times each year. Medications may help prevent gout attacks in people with recurrent gout. If left untreated, gout can cause erosion and destruction of a joint. Advanced gout. Untreated gout may cause deposits of urate crystals to form under the skin in nodules called tophi. Tophi can develop in several areas, such as your fingers, hands, feet, elbows, or Achilles tendons along the backs of your ankles. Tophi usually aren't painful, but they can become swollen and tender during gout attacks. Kidney stones. Urate crystals may collect in the urinary tracts of people with gout, causing kidney stones. Medications can help reduce the risk of kidney stones. Juvenile idiopathic arthritis, formerly known as juvenile rheumatoid arthritis, is the most common type of arthritis in children under the age of 16. Juvenile idiopathic arthritis can cause persistent joint pain, swelling, and stiffness. Some children may experience symptoms for only a few months, while others have symptoms for many years. Some types of juvenile idiopathic arthritis can cause serious complications, such as growth problems, joint damage, and eye inflammation. The most common signs and symptoms of juvenile idiopathic arthritis are pain. While your child might not complain of joint pain, you may notice that he or she limps, especially first thing in the morning or after a nap. Swelling. Joint swelling is common but is often first noticed in larger joints such as the knee. Stiffness. You might notice that your child appears clumsier than usual, particularly in the morning or after naps. Fever, swollen lymph nodes, and rash. In some cases, high fever, swollen lymph nodes, or a rash on the trunk may occur, which is usually worse in the evenings. Juvenile idiopathic arthritis can affect one joint or many. There are several different subtypes of juvenile idiopathic arthritis, but the main ones are systemic, oligoarticular, and polyarticular. Which type your child has depends on symptoms, the number of joints affected, and if a fever and rashes are prominent features. Juvenile idiopathic arthritis occurs when the body's immune system attacks its own cells and tissues. It's not known why this happens, but both heredity and environment seem to play a role. Several serious complications can result from juvenile idiopathic arthritis. Eye problems. Some forms can cause eye inflammation. If this condition is left untreated, it may result in cataracts, glaucoma, and even blindness. Eye inflammation frequently occurs without symptoms, so it's important for children with this condition to be examined regularly by an ophthalmologist. Growth problems. Juvenile idiopathic arthritis can interfere with your child's growth and bone development. Some medications used for treatment, mainly corticosteroids, also can inhibit growth. Reactive arthritis is joint pain and swelling triggered by an infection in another part of the body, most often the intestines, genitals, or urinary tract. This condition usually targets the knees, ankles, and feet. Inflammation also can affect the eyes, skin, and the tube that carries urine out of the body, urethra. Previously, reactive arthritis was sometimes called Reiter's syndrome. The signs and symptoms of reactive arthritis generally start 1 to 4 weeks after exposure to a triggering infection. They might include pain and stiffness. The joint pain associated with reactive arthritis most commonly occurs in the knees, ankles, and feet. Pain may also occur in the heels, low back, or buttocks. Eye inflammation. Many people who have reactive arthritis also develop eye inflammation, conjunctivitis. Urinary problems. Increased frequency and discomfort during urination may occur, as can inflammation of the prostate gland or cervix. Inflammation of tendons and ligaments where they attach to bone, enthesitis. This happens most often in the heels and the sole of the feet. Swollen toes or fingers. In some cases, toes or fingers might become so swollen that they look like sausages. Skin problems. Reactive arthritis can affect skin in a variety of ways, including mouth sores and a rash on the soles of the feet and palms of the hands. Reactive arthritis develops in reaction to an infection in your body, often in your intestines, genitals, or urinary tract. You might not be aware of the triggering infection if it causes mild symptoms or none at all. Numerous bacteria can cause reactive arthritis. Some are transmitted sexually, and others are foodborne. The most common ones include Campylobacter, Chlamydia, Clostridioides difficile, Escherichia coli, Salmonella, Shigella, and Yersinia. Reactive arthritis isn't contagious. However, the bacteria that cause it can be transmitted sexually or in contaminated food. Certain factors increase your risk of reactive arthritis. Reactive arthritis occurs most frequently in adults between the ages of 20 and 40. Women and men are equally likely to develop reactive arthritis in response to foodborne infections. However, men are more likely than are women to develop reactive arthritis in response to sexually transmitted bacteria. Hereditary factors. A specific genetic marker has been linked to reactive arthritis, but most people who have this marker never develop the condition. Infectious arthritis, also called septic arthritis, is a painful infection in the joint. It can occur when an infection from another part of your body spreads to a joint or the fluid surrounding the joint. Infection-causing germs may also enter the body during surgery or through open wounds or an injection. Infectious arthritis usually occurs in only one joint. Most cases of infectious arthritis are caused by bacteria. The most common of these is Staphylococcus aureus, staph, Infectious arthritis can also be caused by a virus or a fungus. Septic arthritis typically causes extreme discomfort and difficulty using the affected joint. The joint could be swollen, red, and warm, and you might have a fever. If septic arthritis occurs in an artificial joint, prosthetic joint infection, signs and symptoms such as minor pain and swelling may develop months or years after knee replacement or hip replacement surgery. Also, a loosening of the joint may occur, which causes pain while moving the joint or while putting weight on the joint. Typically, the pain goes away when at rest. In extreme cases, the joint may become dislocated. Risk factors for septic arthritis include existing joint problems, chronic diseases and conditions that affect your joints, such as osteoarthritis, gout, rheumatoid arthritis, or lupus, can increase your risk of septic arthritis. Having an artificial joint. Bacteria can be introduced during joint replacement surgery, or an artificial joint may become infected if germs travel to the joint from a different area of the body through the bloodstream. Taking medications for rheumatoid arthritis. People with rheumatoid arthritis have a further increase in risk because of medications they take that can suppress the immune system, making infections more likely to occur. Skin fragility. Skin that breaks easily and heals poorly can give bacteria access to your body. Skin conditions such as psoriasis and eczema increase your risk of septic arthritis, as do infected skin wounds. Weak immune system. People with a weak immune system are at greater risk of septic arthritis. This includes people with diabetes, kidney, and liver problems, and those taking drugs that suppress their immune systems. Joint trauma. Animal bites, puncture wounds, or cuts over a joint can put you at risk of septic arthritis. Fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain and spinal cord process painful and non-painful signals. Symptoms often begin after an event, such as physical trauma, surgery, infection, or significant psychological stress. Women are more likely to develop fibromyalgia than are men. Many people who have fibromyalgia also have tension headaches, temporomandibular joint, TMJ, disorders, irritable bowel syndrome, anxiety, and depression. The primary symptoms of fibromyalgia include widespread pain. The pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of your body and above and below your waist. Fatigue. People with fibromyalgia often awaken tired, even though they report sleeping for long periods of time. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders, such as restless leg syndrome and sleep apnea. Cognitive difficulties, a symptom commonly referred to as fibrofog, impairs the ability to focus, pay attention, and concentrate on mental tasks. Many researchers believe that repeated nerve stimulation causes the brain and spinal cord of people with fibromyalgia to change. This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain. There are likely many factors that lead to these changes, including genetics. Because fibromyalgia tends to run in families, there may be certain genetic mutations that may make you more susceptible to developing the disorder. Infections. Some illnesses appear to trigger or aggravate fibromyalgia. Physical or emotional events. Fibromyalgia can sometimes be triggered by a physical event, such as a car accident. Prolonged psychological stress may also trigger the condition. Risk factors for fibromyalgia include your sex. Fibromyalgia is diagnosed more often in women than in men. Family history. You may be more likely to develop fibromyalgia if a parent or sibling also has the condition. Other disorders. If you have osteoarthritis, rheumatoid arthritis, or lupus, you may be more likely to develop fibromyalgia. Lupus is a disease that occurs when your body's immune system attacks your own tissues and organs, autoimmune disease. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs. The most common signs and symptoms include fatigue and fever, a joint pain, stiffness and swelling, a butterfly-shaped rash on the face that covers the cheeks and bridge of the nose or rashes elsewhere on the body, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods. The cause of lupus in most cases, however, is unknown. Some potential triggers include sunlight. Exposure to the sun may bring on lupus skin lesions or trigger an internal response in susceptible people. Infections. Having an infection can initiate lupus or cause a relapse in some people. Medications. Lupus can be triggered by certain types of blood pressure medications, anti-seizure medications, and antibiotics. People who have drug-induced lupus usually get better when they stop taking medication. Rarely, symptoms may persist even after the drug is stopped. Factors that may increase your risk of lupus include your sex. Lupus is more common in women. Age. Although lupus affects people of all ages, it's most often diagnosed between the ages of 15 and 45. Race. Lupus is more common in African Americans, Hispanics, and Asian Americans. Inflammation caused by lupus can affect many areas of your body, including your kidneys. Lupus can cause serious kidney damage, and kidney failure is one of the leading causes of death among people with lupus. Brain and central nervous system. If your brain is affected by lupus, you may experience headaches, dizziness, behavior changes, vision problems, and even strokes or seizures. Many people with lupus experience memory problems and may have difficulty expressing their thoughts. Blood vessels. Lupus may lead to blood problems, including a reduced number of healthy red blood cells, anemia, and an increased risk of bleeding or blood clotting. It can also cause inflammation of the blood vessels. Lungs. Having lupus increases your chances of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into lungs and pneumonia also are possible. Having lupus also increases your risk of infection. People with lupus are more vulnerable to infection because both the disease and its treatments can weaken the immune system. Cancer. Having lupus appears to increase your risk of cancer. However, the risk is small. Bone tissue death. This occurs when the blood supply to a bone declines, often leading to tiny breaks in the bone and eventually to the bone's collapse. Pregnancy complications. Women with lupus have an increased risk of miscarriage. Lupus increases the risk of high blood pressure during pregnancy and preterm birth. To reduce the risk of these complications, doctors often recommend delaying pregnancy until your disease has been under control for at least 6 months. Arthritis can significantly impact daily life, but understanding the type of arthritis you or your loved ones are dealing with can help in managing it effectively. Whether it's through medication, physical therapy, lifestyle changes, there are ways to improve quality of life and reduce symptoms. Remember, early diagnosis and personalized care are key to effective management. With that said, thanks for watching, and until next time.